Good morning, everyone. We're glad to have you all join us.
Good morning.
So we're getting started with technology once again, as we're all in different places. One of the, I guess, gifts of this time is to be able to do this sort of gathering with people so spread apart. So we're really glad that you took the time out this morning to join us. We are going to record as well, so we will be able to share it later with others. We know it's a really busy time of year right now to be taking time out to be on a webinar.
Yes, I'll be sending out an email with a link to the recording, and it'll be available on our website shortly as well, so you can have it available.
Great, thanks, Charlotte. Well, welcome everyone. We are really glad you could take the time out today to join us. We are on a webinar, which means that we cannot hear or see you. You can just see us. So if you'd like to talk to us, then we'll ask that you use the chat box. It is down there with the little bubble, and then also the raise hand feature. If you click either one of those, then you'll be able to type in your question or your comment. And we do have somebody monitoring that, so they will be able to let us know. So that's how you'll be able to talk with us through or give us any kind of response through the webinar time. And I am Connie Phillips, and I am the CEO and president here at Lutheran Social Services. And I will be just doing a brief introduction, and then I'm going to get you quickly over to our panelists today. We're very excited to be joined this morning by Maddy Bynes. But first, I always have to do my job and say a few things about Lutheran Social Services. I know many of you already are aware of LSS, but let me just remind you again of our mission. We stabilize lives during times of crisis and transition. We build a foundation where people can thrive, and we preserve dignity and respect for the most vulnerable. We do services in 4 areas as an organization, working in aging and disability services, which is our largest program. We also work with children and families. We welcome and support refugees and provide immigration services. And then in the Maricopa County region, we provide emergency services as well. I'll just remind you briefly about what we do in aging and disability services. As I said, this is our largest program. We have more staff working in this program than the rest of the organization combined. We participate and support people to stay in their own homes. We provide Meals on Wheels in half of the Tucson area. We provide grocery shopping for many people in the Tucson area, and we provide in-home care for those living in Tucson and in Santa Cruz County and in Cochise County. And that includes attendant care, personal care, housekeeping, respite, and companion care. Today, we are going to be talking about advocacy regarding this area, aging and disability, and how we can use our voices to speak up on behalf of the people that we're serving, because so many of the folks that we see on a regular basis, they don't have the ability to contact their legislators or to go to the Capitol, and they depend on us. And this service of advocacy, this ministry of advocacy, is it's important. It's in order, to be able to address the foundational needs of the people that we're serving. We must take their stories to our public policy representatives on the local levels, on the state level, and on the national level. So that's what we'll be addressing today, is how we can use our voices in this manner. So I've introduced myself. The other person you'll hear from today from Lutheran Social Services is Charlotte Schertz, and she's our Faith and Community Engagement Coordinator. She has primarily been working in the field of refugee resettlement and doing advocacy work around this issue, as well as working directly with our clients and our families and connecting them with the community. And so we're all on a learning curve. She'll be working in the advocacy for all of our programs. And so we're all really excited to be learning about how we can effectively do that by partnering with Maddy Bynes, who's the Director of Public Policy and Special Projects with Pima Council on Aging. And let me just tell you briefly before we get into into Maddy's remarks, Lutheran Social Services had a very long relationship with Pima Council on Aging. They are a partner. We are partners together in this work. They are, and she'll tell you who the area agencies on aging are and tell you more about this, but basically they're a funder for us. We're a subcontractor to them, but we're much more than just that business relationship. We really are together in working on behalf of seniors and people with disabilities as we move forward. We take direction from Maddy, from Pima Council on Aging. We get involved with different opportunities that come to us through this relationship, and it's very much a part of how we do our work. Pima Council on Aging is seen as a real leader in the state as well as nationally. I know that they have really taken up the mantle so many times. And I know that their president and CEO has testified more than once, I think, at congressional hearings. They're active on the national stage as well as the local and statewide stage. Maddy herself is from Tucson. She's a U of A grad, go Cats. She has worked in the political field all of her career, I believe. She's worked in county and state and national elections. She started at PCOA 4 years ago as a public policy coordinator and was promoted into this director position. She is also the statewide coordinator for the Arizona Association of Area Agencies on Aging. So we are excited to learn from her, and I'm going to turn you over now to Maddy.
Fantastic. Thank you so much, Connie, and thanks everyone for being on the call. I'm really looking forward to virtually being able to talk with you. And I think in the settings in virtual times, it's really hard to have a conversation, which is more how I like to talk about advocacy, because I don't think it's clear cut. I think that there's a lot to learn, and we all have various degrees of knowledge currently on advocacy, and then of course how we're going to pursue that in the future. So please use the chat or raise your hand or question and answer feature. I don't think you can just talk, but feel free to interrupt me if that's at all a possibility. I think that's always better and makes for more fun times. So please be sure to interact. It makes it a lot less boring for me. So that will be great if you can do that. If you could go to the next slide. So I wanted to do a little bit of civics recap for everybody, because I think it's been a little while. I have a formal education in government, so for me, this feels second nature, but I know from many of our staff and colleagues throughout the state and then throughout the nation that the idea of civics sometimes escapes us. So at the federal government, we have 3 branches of government, of course, and we have the same 3 branches in state government. At the federal government, the executive branch is the president's cabinet. So that's like the Health and Human Services Secretary, Secretary of Defense, Secretary of State. That's all part of the president's cabinet. And then those cabinets positions run their respective departments. And so basically anything that needs to be executed as part of the executive branch. Congress, as we all know, makes the laws. So that's both the House and the Senate. They make up Congress. And then you have the judicial system, which is a system of the Supreme Court and then the federal court system. At the state level, it looks much the same. We have the governor, who is the leader of the executive branch. He hires his department heads. So that's like access is a department, the Department of Economic Security, the Department of Child Safety, the Department of Corrections. Those are all parts of the executive branch. Then you have the legislative branch, which is the Arizona legislature, and that's comprised of the Arizona House and the Arizona Senate. And then you have the Arizona Supreme Court and the Arizona court system, which is the judicial branch. Next slide. So I wanted to give you kind of just so we're all starting at the same spot on local versus state versus federal. I wanted to give you a civics recap, but really I'm here to talk about the Older Americans Act and the area agencies on aging, and what we do in our respective communities. Of course, I know most about Pima Council on Aging, as that's where I primarily work, but as Connie mentioned, I represent 7 out of the 8 area agencies on aging in the state. The only one that I do not represent through the Arizona Association of Area Agencies on Aging is the Navajo Nation. So I represent Intertribal Council of Arizona, SEGA, WACOG, NACOG, Pinal Gila Council for Senior Citizens of Maricopa County, AAA Region 1, and then PCOA. The area agencies on aging are created through this piece of legislation called the Older Americans Act. And the Older Americans Act was passed in 1965. And it was part of President Johnson's war on poverty. And so it was passed and really was to be a landmark piece of legislation, which I believe it still is. In 1973, it was reauthorized, and I'll talk about what reauthorization is in a moment, but it was reauthorized to make area agencies on aging. And so area agencies on aging are specific, they have specific service areas, and they exist all throughout the country, and they all do pretty much the same work. They all work in what the Older Americans Act defines. And many area agencies on aging do more than what the Older Americans Act defines, like PCOA, but some area agencies on aging do just what the Older Americans Act defines. So it varies, but there's pretty much a set service criteria that they have to offer. So there are 622 nationwide and 250 Title VI programs, and those are the Native American programs for the Older Americans Act. And I talked about reauthorization a little bit. Basically, that's a process in which Congress looks at large pieces of legislation. You might hear in the news about the Defense Reauthorization Act. Americans Act reauthorization goes much through the same process. They look at the piece of legislation, talk about what is needed in the country, and make any changes. So the Older Americans Act is very much a living document. It was, there at some points they added in supportive services, they added in nutritional services. In 2000, they added in the Family Caregiver Supportive Program. Most recently in 2012 or 2016, I can't really remember which, they added in healthy living programs, so evidence-based programming for healthy living. And then we just actually had reauthorization this year. It was supposed to be done last year. Congress tends to run a little off, as we're all aware from the budget this year, but we were just reauthorized. However, there wasn't really any sweeping new pieces in that legislation. There mostly modifications. Next slide, please. So the Older Americans Act, as I said, passed in 1965. At the time, nearly 2/3 of people over the age of 60 were living in poverty. And today in the US, 20% of Americans are 60 years of age or older. And today in, today in Arizona, 21.5% of Americans are about 60 years of age and older. So you know, we are seeing a growing population. About 10,000 baby boomers per day are hitting retirement age. And this is something that we see in the national news a lot. You know, how are we going to make Medicare and Social Security solvent? What are we going to do in regards to this aging population in terms of caregiving? You know, this is something that we've never faced before. People are living much longer than they ever have lived in human history. So what are we going to do as a society to support these people? The Older Americans Act provides a good basis for that. There are various different services that each area agency on aging has to offer. We have to do advocacy, and that looks different throughout the country depending on the agency. We have to provide home and community-based services. These are services like bathing or dressing or light housekeeping or grocery shopping. We have to provide what's called Title III-C nutrition programs, which are Meals on Wheels, and then also community lunch programs, congregate meals throughout each community. Have to provide family caregiver supportive services, information and referral services, and the long-term care ombudsman service, which is in Arizona, we have to provide the long-term care ombudsman service, which is essentially ombudsmen that go into long-term care facilities and advocate on behalf of resident rights. Next slide, please. In Arizona, aging is definitely at the forefront of everyone's mind. The population, the most quickly growing or fastest growing portion of the population are older adults. 90% of Arizona's older adults are white. The next racial and ethnic class identified is 12% are Latinx. The 36.6 older Arizonans live alone. So that is a very telling number in the services in which we need to provide to make sure that people have the supports to live with dignity and respect as they age. You know, living alone can be very difficult. It can be socially isolating, especially during these times. Being able to do physical work or have help around the house, all those things are very important. And nearly 40% of the population of older adults lives alone. So this is specifically a very important fact to look out for. 5% of older Arizonans live with their grandchildren, and many are raising their grandchildren. So foster kinship programs are very important. 12% of older adults are immigrants. The Social Security mean income is $18,305 a year. That's not the mean income for every household, but I want to stress that many households do rely primarily on Social Security. So that's quite low. I believe that's around 150% of the federal poverty level. The mean household income for older adults in Arizona is about $50,000 a year. And so, as I said, many people do have more than just Social Security, but that's not the fact for everyone. 7% of older Arizonans rely on food stamps, which is the Supplemental Nutrition Assistance Program. 18.1% of older Arizonans make less than 150% of federal poverty level. And that's about $18,000 a year. So that's quite a substantial number of older people who are living in poverty. And then 17.5% of older Arizonans rent. And of those 17.5%, over 50% are considered home burdened, which means that they pay more than 30% of their income in housing. So that's very significant, especially as we go into January and we know that the federal moratorium on eviction and foreclosure is going to end, and the state moratorium. As we go into that, we expect to see higher homelessness rates of older adults. And we expect to see a lot more housing instability, specifically because we have such a high number of people who are home burdened. Next slide. So as I said, the area agencies on aging are set to not only provide services, but help our leaders in the state, specifically in elected office, address some of these problems that we're seeing. And I think that one of the things that we love to say at PCOA is problems are treasures. So I don't think we really look at them as problems that we can't solve, but really opportunities to help people. And I think that that's something we share throughout the state. So here are the individual regions. You have Region 1, which is Region 1 Area Agency on Aging, and they solely serve Maricopa County. I am in Region 2, Pima Council on Aging, and we solely serve Pima County. Region 3 is the Northern Arizona Council of Governments, and they serve Yavapai, Coconino, Navajo, and Apache counties. Region 4 is Western Arizona Council of Governments, and they serve Yuma, La Paz, and Mojave counties. Region 5 is Pinal Gila Council for Senior Citizens, and they serve Pinal and Gila counties. Region 6 is Southeastern Arizona Governments Organization, and they serve Santa Cruz, Cochise, Graham, and Greenlee counties. Region 7 is the Navajo Nation, which is not part of the Arizona Association of Area Agencies on Aging, and I do not represent them. And then Region 8 is the Intertribal Council of Arizona, and they represent 21 of the 22 tribes in Arizona. The way that the funding works for area agencies on aging is much the same way that much of the federal funding that flows into Arizona works. So it starts with Congress approving appropriations, and that bill for appropriations, the 12 appropriations bills, go to the president's desk for signature. After that happens, the Department of Health and Human Services Administration for Community Living passes money along on a formula basis to the states. In Arizona, we have a state unit on aging, and that state unit on aging is the Department of Economic Security Division of Aging and Adult Services. And so the state of Arizona has to match up to, I believe it's 10% of what the federal government sends to Arizona in order to get the federal money. On top of that, local area agencies on aging also have to come up with a match. So as you can see here, the area agencies on aging, we all come up with a match to draw down state and federal monies. Next slide. So how the government funding works for PCOA and for many of the other area agencies on aging, I'm using PCOA as an example, but really where the funding differs from PCOA to other area agencies on aging is on the local end of things. So at the federal level, you have the Older Americans Act. We also get money from the Social Services Block Grant, Community Development Block Grant, State Insurance Assistance Program, Senior Medicare Patrol, and Corporation for National and Community Services. So quite a few different things to keep your eye on at the federal level. At the state level, we are funded through the State Planned Social Services Block Grant funding, the Arizona General Fund, and then sometimes we're funded through lottery funds or some other special line items in the Arizona state budget. But in general, this is what we're funded through. And then at the local level, and something that Connie mentioned before, is we're right now at Pima Council on Aging working with Lutheran Social Services to provide grocery shopping assistance to people in need during the pandemic. That's specifically coming from City of Tucson CARES Act funds. So at the local level, we also work with our cities and counties to ensure that we're A, meeting that match requirement to draw down the state and federal monies, but B, using some of those local funds to address specific community needs to Southern Arizona or rural areas like La Paz County. So we're really cognizant of the local funding too in each of our respected areas. Next slide. So like I said, we do a lot of state. I primarily work on our state policy. And so we do a lot of statewide advocacy and legislative advocacy. So I am a registered lobbyist on behalf of Pima Council on Aging and also on behalf of the Arizona Association of Area Agencies on Aging. And what we're going for this year, we have two priorities. One is to increase funding for the area agencies on aging by about $5 million to account for additional rates of increases in the provider network for direct care workers. And that's a really complicated ask, but essentially, with Proposition 206, which I want to be very clear, we support, that's the minimum wage proposition, which basically raised minimum wage up until this year. And we supported that because we believe that all of our workers deserve a living wage in which they can support themselves and their families. But what we've seen from that are some unintended consequences, one of which is wage compression. And what that essentially is a direct care worker is now making about $12 to $12.10 an hour for their work statewide. That's on average. And so, that's minimum wage. When we look at what are we doing to get more workers in the door, one of the problems that we contend with is that the direct care workers are doing a really physically and emotionally taxing job. They're taking care of our loved ones in their homes. And that's not an easy thing to do. I can tell you, I have cared for grandparents when they have gotten out of surgery, and that is not an easy thing to do. Um, and it's certainly a commendable job when you can do that, or you can get a job at McDonald's or Starbucks or Walmart or Target for the same wage. You might want to maybe go to one of those stores to get a job like that where it's not so emotionally specifically emotionally taxing, but there's some physical tax on it too. So we see people leaving the direct care workforce for some jobs that are not necessarily, they have different challenges. So I don't want to say they're necessarily easier, but maybe less emotionally and physically taxing. The other thing we are running up against as area agencies on aging is we compete for the workforce with other contractors. So, for instance, Access which is the state Medicaid program, has the All-Tex program, which is the Arizona Long-Term Care Program, and they pay for home and community-based services as well, which is great. Access also often gets rate increases, and they have recently gotten a rate increase. We have not had an increase in our funding for home and community-based services from the state of Arizona since 2016, when the minimum wage has gone up from 2016 by 34%. So our ability to contract at a competitive rate is really diminished when we don't have these increases in funding. So we're really, really focused on that, because what will happen if we don't have those increases is we will have to take people off of service, or we will have to reduce their already very limited hours of service. And that has a really huge ripple effect throughout the state. If we don't provide home and community-based services to people in need, the shopping, the bathing, the dressing, the housekeeping, lots of those people will become people who are neglecting themselves and will be reported to adult protective services. Those adult protective services cases will be opened, and that's an overburdened system right now. So the ripple effects are really immense. People might experience more falls because they're trying to clean their house, or they're trying to cook for themselves, or they're trying to bathe themselves, and they might fall in the shower. If that happens, they're going to an emergency room. That might be paid for by Access if they're low income. So really, this small investment up front of home and community-based services funding for the area agencies on aging is going to save our society a lot more money, and specifically the state, through Access. The second ask that we have at the state legislature this year is about $1 million in increased funding for the long-term care management program. prior to the pandemic, we were short about 13 additional FTEs for that program. So we actually don't meet the Institute of Medicine's recommended visits for long-term care beds, which is about one long-term care ombudsman recommended to visit 2,000 beds. We have about one long-term care ombudsman for almost every 3,000 beds. So we certainly, before the pandemic, needed additional FTE, which is full-time employees. However, since the pandemic began, we have learned that we have more needs. We have additional need for PPE. At every stage of community spread, whether it's minimal, moderate, or substantial, ombudsmen are supposed to go into those facilities. And we need to make sure that we are being safe, both at work and not at work, but we need to make sure that we are being safe in how we are entering those facilities, because the last thing we want to do is bring COVID-19 into one of these facilities. We've all seen in the news that once it gets into a facility, it is not a good story. And so we are very, very careful and need to make sure that we're using the proper PPE to reduce that risk for people in those congregate settings with extremely vulnerable older adults. The other thing that we're really running up against is the testing, being able to test and make sure that our ombudsmen don't have COVID-19 is really important. I know it's only a point in time, but if you do that point in time testing once a week, you can be pretty certain that you're not bringing COVID-19 in. And you are also able to isolate or quarantine when you do identify someone with COVID-19, and you're able to contact trace. We're also only allowed to, during COVID-19, go into one facility per day so that we're not spreading potential for spread from facility to facility. So all of these lead to additional costs that we have for the program to operate effectively. And so that extra $1 million is going to go a long way in being able to represent the rights of the people living in long-term care facilities. Next slide. So I talked a little bit about the factors. Another factor that we have for that first legislative ask, the $5 million, is that the area agencies on aging have a waiting list statewide for home and community-based services. We have been able to reduce the waiting list through some additional social services block grant funding provided to us by Governor Ducey. And so we currently have a waiting list of a little under 2,000 people waiting for home and community-based services in the state. The other problem that we have is because there's such a shortage of direct care workers, because of all those things I talked about, the wages, the training, the upward mobility, all that stuff has led to a severe shortage of direct care workers. We have some money to be able to provide services, but we can't necessarily get those services into people's homes because we can't find a direct care worker to go into those people's homes. And if we are able to offer a more competitive rate, we will be able to attract more talent. So these are all factors that go into that first legislative ask. Next. In terms of long-term supportive services and the system of long-term supportive services in Arizona, there's multiple tiers of service. And I don't mean tiers as in quality of service, because we offer high quality services, but tiers in terms of payment processes. So you have the Arizona long-term care system, and that is really taking care of the most financially vulnerable older adults in Pima County and throughout the state. These are people who qualify for the long-term care system. It has means testing. It's a whole process to get into. You have people also who can do private pay. They can pay the however many dollars an hour it takes to have a caregiver come in a few times a week, right? But there's this gap of people before who can't do private pay, they don't have enough money to do private pay, they also aren't on the Arizona long-term care system. And that gap of those people, that's what the area agencies on aging serve. We provide services for those folks, and significantly underfunded. So when you're thinking about the long-term care continuum, I would think of it just like that, as a continuum. As you might, by funding area agencies on aging and the services that Lutheran Social Services helps to provide, you might be, pushing the ball down the road of someone applying and getting into Altex for 10, 15 years. And that's a great thing for the state. They're getting the help that they need, but Altex is a much more costly program than the area agencies on aging. They provide many more hours of service than we do. So it's really a continuum, and being able to pay for some more preventative measures up front helps us save money in the long run and help get the resources they need at the time in which they need them. And then, of course, if people can't live independently in their own homes, there's always the option of going into a long-term care facility. But these facilities are costly too. And it's much cheaper for people to stay in their own homes and get the supportive services they need in their own homes to stay there. So it's all really a continuum, but those are kind of the options for long-term supportive services that we have in Arizona. Next. I think I sufficiently covered this, so we can go on to the next slide. In terms of federal priorities, there are kind of three things we're going after right now. One is funding for COVID-19 relief. And we need that funding pretty significantly in Arizona right now. We currently have multiple AAAs, area agencies on aging, who are out of COVID-19 relief meal funds. So those were funds passed through the Families First Coronavirus Response Act and the CARES Act, and they're out of those funds. So, but we still, as we all know, and I hope you are taking it seriously and wearing masks and not going out, we're still in the middle of a really raging pandemic. I think I was I listen to the New York Times every morning. They have a podcast, and the reporter who covers the COVID-19 crisis said we're entering into a phase that is pretty much going to be a valley of death, is the term he used. And it's true. We're seeing crisis after crisis in our hospital system, and that's going to disproportionately impact older and more medically vulnerable people. We know about 75% of the people who have died from COVID-19 in Arizona are over the age of 65. Chances of somebody my age in their 20s dying of COVID-19 is very low. And we know that a majority of the cases in Arizona are people between 20 and 44. However, those people don't live in a bubble. They go see their parents and their grandparents. They go to the grocery store. So we all need to do our part. But the biggest issue with COVID-19 for area agencies on aging, on top of the staggering amount of need that there is in the community, is the issue that we have not had a funding relief package to offset those needs since April. And we are really heading into a very bad winter. So that's definitely a need that we're working on quite significantly. In terms of appropriations, there are multiple issues. Prior to COVID-19, we had appropriations issues. Even before all of this, we had substantial appropriations issues. And the biggest issue was that we have not fully recovered from the 2008 market crash. We have not seen our funding restored significantly, and we know that the population has increased. So we're doing much more with much less. On top of that, the CARES Act and FFCRA have added about $1.1 billion into the area agencies on aging, essentially doubling area agencies on aging budgets around the country. This is not a problem in and of itself. I want to be very clear. We're so appreciative of the additional funds, and they have been very helpful for our communities. However, if we don't have appropriations that can keep up or at least step us down in some way, we are going to find a cliff of people come September 30th, 2021, who are going to drop off of service. There's no way around it if there's not additional appropriations ongoing. Just because the pandemic stops does not mean that these people did not have a need. Because the services, the area agencies on aging have been so underfunded for so long, many haven't advertised and just started advertising because of COVID-19 to get more people in the door to help more people. Now people know about area agencies on aging. Now people are utilizing the services. People who are utilizing the services might still need the service after they get a vaccine. And we're also very involved in making sure that we're staying on top of rule changes. And these are more, I guess, more process-based. So a department can change a rule, and that can mean various things. For instance, there was a rule change behind the public charge announcement.
I think Maddie froze, so we'll wait for her to rejoin us. Oh, I think she lost her connection.
Well, shall we go to Charlotte's, and if she comes back, she can.
Yes, I think she was almost finished looking at her slides. So I would have thanked Maddie. Hopefully she is going to be back so I can tell her that. I really feel like I have learned so much. There was such really important and great information in that webinar. And I think we're going to continue to talk about that information. It was a lot of information and really important and relevant. So we will continue to send information about that to remind ourselves and you about what Maddie talked about throughout the webinar. Of course, with all of that information, we are going to get involved. As Connie said, this is something that we want to take on even more strongly this year in 2021. So I will continue to send you emails on a monthly basis where I ask you to contact your legislators. This right now, as people are coming in, is a great opportunity to congratulate them on their election and to introduce yourself to them if you haven't done that yet. But more specifically, we will ask you to contact them about some of the issues that Maddie mentioned. We will, of course, continue to have webinars like this one where you can get involved and continue to educate yourself. If you are watching this on a recording, this is great. You are doing that just right now. And if you want to share this webinar with other people that you know that might be interested, this is also a great opportunity to learn. We are going to be meeting with legislators about all of the issues that we care about and the issues that Maddie talked about. Of course, we are planning on having meetings about those as well. As soon as she tells us what the important actions are, we will mirror that and we will support them with that, and we hope that you will join us in doing that. We'll have lobbying days this year, probably a couple of them. Two of them will have a different focus, so you can get involved in whichever one has the issues that you're most interested in, but I can foresee that, again, the issues that Maddy talked about will be definitely on the table and part of the discussions we'll be having. And we will also have a letter writing campaign. This is something we're still figuring out and discussing as the end is wrapping up, and we're going to go into the next legislative session in January. So again, stay tuned on that. I will send an email with more information about all of that. Is Maddy back? I think
I am.
Yes.
I am so sorry.
No
I think during
worries.
the time of COVID, we can all say that we've had weirder things happen. My internet apparently went out, so I'm joining you from my cell phone.
Oh, no worries. Okay, so I think you were right there. You can finish up and then we can wrap up with questions. So I'll mute myself if you want to go back to wherever you were.
I think we could go on to the next slide. I was just wrapping up on that. I think you covered this pretty well in what I just briefly heard, but we do quite a few things at the Capitol in terms of both federal and state advocacy. So we have roundtables with elected officials. Right now, those are taking place virtually. We do Older Arizonans Day at the Capitol. I'm hoping to have a virtual, maybe Older Arizonans Week, where people can advocate on our behalf. We do a lot of digital advocacy and actually have won national awards for our digital advocacy. So we do a lot of stuff on social media, Twitter, Facebook. We also do a lot of stuff on our website at advocate.pcoa.org, which will be on the next slide if you didn't catch that. We provide community meetings and do legislative visits. What you can do is you can stay informed, and the best way to do that is we have an email listserv. And if you email Charlotte, or my email should be on a slide coming up here, I will get you on that listserv. Also, you can go to advocate.pcoa.org. They have on that website some take action buttons. So you can use those to take action on specific pieces of legislation. You can also at advocate.pcoa.org sign up for our advocacy alerts. And then, of course, and I know we just had an election, so it's not as relevant, but there's always local elections, and then there's the midterms coming up in 2 years. Definitely vote. It's so important to exercise your right to vote, and that's really how we get to weigh in on our political process. So go out there, make sure you're voting. This is my contact information for anyone who has questions and doesn't feel comfortable asking them now. That's my cell phone number, so feel free to call or text, and that's my email address. And I know you had some other slides, but if you want to leave that one up for a second so people can take that information down, I'm happy to take any questions. I'm not sure I saw any in the chat while I was on my computer, but I can't read them now.
No, I haven't seen any questions come in yet. So if anyone has a question, you can write to us on the chat or in the Q&A function. If you click on that, then we'll be able to answer your questions there as well. All right, let's move on to, we talked with Charlotte and a couple more.
Yeah, a couple more points. Thanks, Heidi. Thank you, Maddy, for being a little bit more specific about some of the actions that we'll be able to take specifically in regards to this issue. So we will definitely follow whatever you are doing and then share that. with our volunteers and our network of advocates. We really look forward to that. So if you are, in addition to the advocacy, interested in volunteering, there is a link right there on the screen where you can go to our website and look at all of the different volunteer opportunities and projects that we have available. We update those constantly. Of course, you can always email me directly, and then I will, in our follow-up email, also provide that link so that you can just directly click on it if you don't have time to write it down at the moment. Of course, we also have on our page and on all of our emails, an opportunity for you to donate. Of course, this is, as Maddy hinted at, it's also very important for us to continue to maintain the services and to serve the people that we care about. And then, of course, if you're interested in finding out more about receiving direct services, there are also phone numbers and an email address right here that you can take down if this is what you're interested in. Again, a lot of information here on that slide, but I will provide that in our follow-up email if you don't have time to take it down at the moment. I think if you want to go next, we have one more opportunity for anybody else who may have had some questions.
Well, thank you everyone for spending this time with us. We will, as Charlotte said, and as I said earlier, have this as a recording. So, and you will get the follow-up information with links. Feel free to share this information. Maddy, thank you so very much for giving us your time, for taking the time to get ready. I know it's a very busy week for you all there, and we are just really grateful. And we will look forward to seeing you on our next webinar that will be about another of our topic areas.
Absolutely.
Thanks
And
for
watch
having
for
me.
my email. Thank you, Maddy.
Thanks, everyone.
Thank you, everyone. See you next time.